Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
And good afternoon. Welcome to Life Unrehearsed. I'm Matt Del Vecchio, specializing in elder care planning, downsizing in the senior living industry. Thank you for tuning in. Coming up on the first half of the show, risk factors for dementia. And I'm very pleased to have one of the leading neurologists specializing in dementia to discuss this topic, Dr. Serge Gauthier. We're going to be talking about the 12 key modifiable risk factors that are in our control. And on the second half of Life Unrehearsed, we're going to have a little fun as we look at the lighter side of aging. We're going to tackle, we tackle many challenging topics on Life Unrehearsed, some of them quite heavy. So how about discussing an amusing take on aging? And that's going to be coming up after the 4:30 news. Hope you're enjoying your Sunday, a little chilly one today. Some of you might have even seen the first snowflakes earlier on today. Well, you're going to have to dress the kiddies up for Halloween on Tuesday. We're looking like a high of 4, but so far no signs of precipitation for Halloween evening. All right. Last month, Alzheimer's Disease International, based in London, England, released the World Alzheimer's Report 2023. This is quite a prestigious report recognized around the world, and I was very fortunate to have contributed an article to this report last year on the topic of planning for the transition of care. Well, this year's theme of the World Alzheimer's Report is reducing dementia risk, never too early, never too late. The report focuses on reducing the risk of dementia and offers a truly global insight into the ways in which dementia risk factors are experienced around the world. One of the key topics was concerning the 12 risk factors of dementia, with many of them controllable. I'm very proud to have as our guest one of the world's leading neurologists with a specialty in dementia, Dr. Serge Gauthier. Dr. Gauthier is an emeritus professor in neurology and psychiatry at McGill University, and he is the co-lead of the dementia education program at McGill. He has also been a major contributor over the years to the annual World Alzheimer's Report. Dr. Gauthier, welcome back to Life Unrehearsed.
Thank you, and good afternoon to you and everyone.
Well, good afternoon. Thank you for taking some time on Sunday on really what is becoming a very hot topic. And just a couple statistics for our listeners. As of 2020, there were approximately 597,000 people living with dementia in Canada. And that number is expected to jump to almost 1 million people by 2030. That's just another 7 years. Very concerning, but there are things we can do in our own day-to-day lives to reduce the risk of dementia. So let me rattle off the 12 modifiable risk factors to dementia to get this started. Physical inactivity, excessive alcohol consumption, obesity, air pollution, less education, social isolation, head injury, diabetes, depression, hearing loss, smoking, and hypertension. Now, those are the 12 that were deemed modifiable risk factors. And, it's been estimated that around 40% of dementia cases may be the result of these 12 key factors. And it's encouraging to know that we can individually make a difference to minimize our risk of getting dementia. So, Dr. Gauthier, can I get your thoughts about these findings and the research that went into it?
Thank you for your interest in this topic, because it is good news for the public at large, because these are things we can control at a population level. This is the way to go, prevention. This document you referred to, which people can get access to for free, just type on Google World Alzheimer Report 2023, and you can download it. It's a summary of the literature pretty much up to the pandemic. And the list that you just initiated, we can go back some of the items that are more relevant for the Canadian audience, are important as a global health strategy.
Yeah, Dr. Gauthier, it's quite amazing how some of these risk factors are quite modifiable, and that's why I'm glad you can bring your perspective. I must remind our listeners, one of the leading neurologists, and based right here in Montreal, we're very lucky to have Dr. Gauthier and all the research he's done throughout a lifetime of research. So of these 12 risk factors that we've talked about, are there any ones, Dr. Gauthier, that we could focus on as the highest priority?
Well, certainly we've known for some time that the combination of hypertension, high blood pressure, especially the first number, systolic, diabetes, obesity, and smoking, especially if you do all the four, you're more likely to get a heart attack and stroke. And if you survive that, you get dementia. And particularly in Ontario, they did a very nice job at stroke prevention, and we should do as well in Quebec. But this is for people in their 40s, 50s, and onward. For people who may be now over 65, including me, we need to be more physically active. And this is something that stands out for North Americans. We're not physically active enough. It doesn't mean running a marathon. It just means get out of the house, 20-minute walk. Ideally at a fast pace. You should have a little sweating. Myself, I got a dog, so I'm out six times a day, but I'm not walking fast. The other thing from the pandemic, we've been drinking a bit too much, and you may recall that there was some debate in Quebec, what's the recommended alcohol amount, and certainly should be no more than 1 glass a day on average, whatever you like. The old issue of 2 glasses a day for men, 1 for women, I think we should be more reasonable than 1 glass a day on average per person.
Very good points, and I might add, being a dog lover, Dr. Gauthier, you got a lucky dog, six times a day for a walk. Good on you, but that's a perfect example of the physical inactivity. We tend to think sometimes as we age, geez, I can't go to the gym. That's not me anymore. But simple walking, get that heart rate going, and I'm glad you brought that up. Now, I often get asked, Dr. Gauthier, about there are some non-modifiable risk factors, for example, genetics. So does that mean you just can't do anything about it, or can we still take some proactive initiatives to reduce our risk?
This is an excellent question, and I have a good answer for you. Because the most common risk factor that we inherit from one of our parents is called APOE, APOE4. It's a variation on a gene that determines how efficiently you can carry cholesterol in your blood and into your brain. And if you have only one copy from one side of the family, you have slightly higher risk compared to the average person. But we know from epidemiologic work that if you have a healthy lifestyle and you modify these 12 items you just listed, you compensate for that genetic risk, which is the most common one in our milieu. If you have 2 copies, 4-4, that's a slightly different story, but it's only 3% of the general population. And possibly there'll be a special treatment in 2 years for those who carry double dose of that genetic risk.
Interesting. But it is encouraging, though, because, people get worried, especially, if there is that genetic risk. But it doesn't necessarily mean that it is a terrible situation for you, like you said.
Especially if you pay attention to those modifiable risk factors. The one new thing that your audience may be interested to know is we may have a blood test pretty soon to determine if this genetic risk is starting to influence your brain activity, and if some proteins associated with aging are building up. So it's a bit like what we do now for prostate cancer. If you're at risk, there's a blood test. Certainly for colonic cancer, there's a blood test. So we're close to that for Alzheimer's.
Very encouraging, because we are going to talk about that. We do have to head out to traffic soon, Dr. Gauthier, and I am talking with Dr. Serge Gauthier, who's joining me here on Life on Rehearse, and we're talking about the 12 modifiable risk factors concerning dementia. And, when we come back from traffic, Dr. Gauthier, there are some encouraging signs, both pharmaceutical and medical. As we know, there is no cure for Alzheimer's, and we're going to pick your brain a little bit and go into layman's terms, because we need some definitions. Dementia very often gets aligned with Alzheimer's. People think it's the same thing as different. So perhaps you can clear the air for some of these terminologies. And more importantly, is there hope for the future? And welcome back to Life Unrehearsed. Matt Delvecchio here, and I'm talking about the 12 modifiable risk factors to dementia with neurologist Dr. Serge Gauthier. So if you didn't catch the first part of the segment, let me repeat these 12 modifiable risk factors. Starting with physical inactivity. excessive alcohol consumption, obesity, air pollution, less education, social isolation, head injuries, diabetes, depression, hearing loss, smoking, and hypertension. And as you heard from Dr. Gauthier before, if the smoking, hypertension, diabetes, and obesity didn't get you for dementia, it might get you for stroke first and then dementia. So it's all kind of tied in. And Dr. Gauthier, we're going to back up a little bit, and I'd like, from your perspective, very often when I'm out there with families, there seems to be the terms dementia and Alzheimer's that are changed, interchangeable, but in fact, that is not the case. Can you explain the difference between dementia and Alzheimer's?
It's a very common question. You're quite right. And the families always ask. The Alzheimer is a disease, it's a specific condition that can lead to dementia. Not all dementia is due to Alzheimer, but practically speaking, over age 80, if you have dementia, it's caused by Alzheimer, but sometimes in combination with small stroke or a bit of Parkinson mixed in or some other condition. The new thing that maybe the listeners may be interested in is Alzheimer's disease is now considered a bit like diabetes. It's there in your brain, slowly evolving, a bit like pre-diabetes. And then you have mild symptoms, a bit like when you start to have your sugar up and you have to go to the bathroom more often if you have diabetes. And then late stage, you get dementia. So the positive side of the new definition is there may be 20 years before you get symptoms during which we can intervene. So today we talk about the modifiable risk factors. That's more like lifestyle change. And then there may be medications for special people who have a higher risk of progression to dementia.
Okay, and you talked about aging, and sometimes we may make the mistake that, okay, if I'm aging, I'm getting dementia, but there is a difference between normal aging versus early dementia, isn't there?
Yes, indeed, and that's the other thing we get asked. Everybody over age 50, there's a slight difficulty in learning a new language, but if you work hard enough at it, you will. I had to learn German because of my 3 grandchildren. So there's hope. But it's normal. And cognitive neuropsychologists, and we have some of the best in Montreal at Montreal Neuro and at the Côte des Neiges Research Institute, they do measure in healthy people over age 20 to 90. And they do measure a decline in your speed of processing information and the ability to learn new things. We mentioned new languages, but you're wiser. you will compensate, and that's the difference between normal aging of your brain and early dementia is you compensate. So you have post-its, you use compensation strategies, you make lists of things to do. As long as you can cope in your routine, either at work or at home, it's not crossing the line into mild dementia.
Okay, so, that is encouraging. Those senior moments, well, it's okay. It just may be simply aging and may not be early dementia. And, you've spent your professional life, Dr. Gauthier, I'm talking with neurologist Dr. Serge Gauthier here on Life Unrehearsed, and you've spent a good part of your professional life doing a lot of research. You've met hundreds, if not thousands, of individuals and families, and you've seen some real development over the last couple of decades. But more recently, is there hope, Dr. Gauthier? There is no cure yet for Alzheimer's, but from a medical perspective, pharmaceutical perspective, how are things looking?
Well, there is some hope for one of the causes of Alzheimer's disease, the buildup in your brain of a protein called beta amyloid. There's 2 medications under review by Health Canada. They were approved or will be very soon in the U.S. So these are medications that you inject in the vein by infusion, a bit like chemotherapy, and over 9 to 18 months, progressively, the amyloid that has built up in your brain over 20 years is gone.
Very interesting.
And there is some evidence that for the average patient who receives this treatment, you delay progression after the treatment it's something like in the order of 5 to 8 months. It's a bit like you're in remission. We're going to use, perhaps, as we explain these drugs when they get approved next year, a bit like chemotherapy. You're in remission. You gain an extra 8 months out of 18, the duration of the studies. And it's possible the infusions, even if you stop them after 18 months, once you've got rid of the buildup of the toxic protein, it's possible the effect will persist. And we don't know what will happen in year 3, year 4, year 5. So there's observation studies now underway to see how long you remain stable. So that's quite encouraging. But that's for people who have dementia associated with the amyloid buildup, and that's not every person.
Won't be all the case. But, I think what leads to the importance of early diagnosis, I mean, just to get the ball rolling in case of these situations. So can you stress the importance of early diagnosis?
So most people who have memory lapses, they want to know, can I do something about it? Is it Alzheimer or not? So the whole medical system across Canada is gearing up, not because we have new drugs in a year or two, but because we owe people clear answers. So the blood tests that I briefly talked about earlier will help. We will have more readily available across the country spinal tap and spinal fluid examination to confirm if there is amyloid or other proteins buildup. And we do have scans of the brain available, especially in Quebec. We're fortunate for that can look at the brain of the person to see if there's too much amyloid, too much tau, if there is inflammation. We're going to adjust the system. But for the average person, how do you get there? So for now, it's going through your family doctor. What we hope is that the Groupe de Médecine Familiale, which is the structure in Quebec that we've favored so far, there will be at least 1 out of 10 physicians with a special interest and a nurse trained to do the memory test and do the basic workup. And then people who have a particular need will be referred fast track to specialty clinics in neurology or geriatrics or psychiatry.
Listening to Life Unrehearsed, Matt Delvecchio here, and we're talking with neurologist Dr. Serge Gauthier. And, I want to just take that a little further because I always get approached with families about asking what they can do to get the ball rolling. They maybe start seeing signs of dementia of a loved one. So what would you suggest to families if they are starting to see signs of dementia?
So we already mentioned seeing your family doctor, but there's a document that's now available to the public at large. It's called Dementia, Your Companion Guide. It's written for people who have mild symptoms or perhaps already have an early diagnosis and their family members to know what's coming and how to plan. It does include also a discussion of the risk factors. So listeners can just go on Google, mcgill.ca/dementia. And then you access the McGill Dementia Education Program and just go get your Dementia, your companion guide. It's available in 10 languages, including Ukrainian, and they're going to use it now over there to help their population.
I'm glad you mentioned that. I do want to talk about a few more resources as we wrap up here on Life Unrehearsed. I'm going to repeat that. That's through the McGill Dementia Education Program. Such a wonderful program headed up. You are very influential, Dr. Gauthier, as is Claire Webster, running a wonderful series of McGill Cares. 10 languages, the McGill Dementia Guide, free of charge. Other resources for families, if they're looking for some help on Alzheimer's or dementia, where can we go in Montreal?
You can also find on this site, we just mentioned, some other resources. Some include interaction with other people and health professionals. It's something Claire Webster has pioneered. There's also the Alzheimer's Society of Canada and our local chapters, the Fédération des Sociétés Alzheimer du Québec, the Société Alzheimer de Montréal, and the various regions. They have their website, and they also have counselors who can advise you how to go about getting a diagnosis and what to do after you have your diagnosis.
Absolutely. Alzheimer's Society of Montreal. I'll throw in Alzheimer's Group Inc., Cummings Center, Nova West Island, and of course repeating the McGill Dementia Education Program, and so much more out there. It's very encouraging to see that there's more and more resources for the general public to look at. And if you care about your loved ones, be proactive. Dr. Serge Gauthier, thank you very much for joining me on Life Unrehearsed.
It's my pleasure. Have a good winter.
Thank you. You too. That's Dr. Serge Gauthier, Emeritus Professor in Neurology and Psychiatry, McGill University. And he's the co-lead of the Dementia Education Program at McGill. And he's also been a major contributor over the years to the annual World Alzheimer's Report. All right, next up on Life Unrehearsed, we're going to take a look at the lighter side of aging as we celebrate the aging process with some amusing stories and anecdotes. That's coming up after a CTV News update.